For anyone facing physical dependency, the first step is often defined by a complete lack of visibility. You know what you're leaving behind, but the actual process of detoxing remains an intimidating unknown that keeps people trapped in a cycle of addiction. Quitting cold turkey carries severe physiological risks. Without constant medical supervision, the sudden shock to the system can trigger severe delirium, intense physical pain, and life-threatening seizures. Medical detox employs a clinical framework to move you from active dependency into early recovery. A team of physicians and nurses monitors your health around the clock, managing your stability through every stage of the withdrawal. Replacing the fear of withdrawal with medical science creates a controlled environment where the recovery process can actually take root. The process begins before you ever enter the facility. The admissions team verifies your insurance coverage immediately, aiming to resolve financial questions before they can delay your care. Upon arrival, clinicians map your ASAM biopsychosocial assessment on a 6-axis radar chart, detailing your physical health, emotional state, and relapse history. Simultaneously, they establish your medical baseline, recording vital signs and blood work to understand your body's function before withdrawal symptoms emerge. By the time you feel the first symptoms, the clinical team has already translated your assessment data into a specific monitoring schedule and medication protocol tailored to your physiology. Physical discomfort typically begins on day 1, often manifesting as anxiety, restlessness, and nausea. Your only responsibility at this stage is to rest while the medical team takes over the management of your symptoms. To track your condition, clinicians use a timeline graph, measuring severity with tools like the CWA or COWS assessments. As scores rise, specific medication protocols push the severity line back down in real time. Day 1 is focused on taking the body's internal physiological panic and transforming it into a managed medical process. Days 2 and 3 represent the peak of the withdrawal curve. This is when the body fights hardest against the absence of the substance, often resulting in physical tremors, severe abdominal cramping, and elevated blood pressure. The medical team responds with continuous monitoring and support, including the use of IV fluids, to prevent dehydration and provide 24/7 nursing care to track every fluctuation in your vital signs. Clinicians make real-time adjustments to medications like buprenorphine or benzodiazepines. These targeted doses maintain your comfort and are critical for preventing severe complications like delirium. To maintain stability during these hours, facilities often minimize staff rotation. Keeping the same nursing and counseling team present allows them to detect subtle changes in your condition that a new face might miss. Successfully navigating the peak of withdrawal relies on this combination of adaptive medical oversight and consistent human connection. By day 4, the timeline graph shows the peak severity curve sloping downwards. As you move towards a stable baseline, your heart rate normalizes, tremors fade, and your appetite begins to return. As the physical storm breaks, a psychological shift takes its place. Many people experience sudden waves of anxiety, guilt, or relief as the brain begins to process the reality of early sobriety. The clinical team manages this transition through transparent communication. Scheduled check-ins explain how your physical progress tracks against the expected curve, which helps reduce the mental anxiety of the process. This phase introduces early psychiatric support. You begin participating in light therapeutic activities and mental health care that focus on the emotional aspects of recovery. As the physical body heals, the treatment pivots from managing physiological symptoms to addressing the needs of the mind. During the final stages of detox, the medical team begins a gradual taper of withdrawal medications. This ensures your body adjusts to its new baseline without experiencing sudden rebound symptoms. Simultaneously, the clinical team collaborates with you to finalize a customized residential treatment plan, identifying the specific therapies that will support your long-term goals. A successful medical detox creates a stable physical baseline that leads directly into the next phase of your treatment plan. Clearing the physical dependency is only the first step. Detox on its own is not a replacement for a full rehabilitation program. Addiction involves deeply rooted behavioral and psychological components. Sustainable recovery requires ongoing treatment through individual therapy, trauma-informed care, and family support services. Because transition planning began during your intake on day 1, You can move seamlessly from detox into residential recovery while your motivation is at its highest. You can replace uncertainty with clinical clarity. The journey toward recovery is a process of small, managed steps, and it begins with a single decision to reach out for a confidential assessment.